Good deal. Listen to it again and take notes and all that fun stuff. And I did find one question in the exam that was incorrect. So it may be easier for me to tell you the incorrect answer to choose, so you get it correct, but it's wrong. But I think it would be easier to let you know what that is rather than trying to tell Alex how to remove the question, because I kind of have, it's one of those things you got to be sitting at the computer and work through the process to remember how to do that. I don't remember how to do that without sitting in front of that computer and doing it. And I'm not going to fly all the way to Spokane tomorrow. Take a question out. I think it's colder there too, so no. Okay. All right. You guys ready? Ooh, I just almost shared the screen with you. I'm not sharing that screen with you. Okay. All right, first let's talk about the phases of general anesthesia. So remember there's 4 phases, right? So who can name the 4 phases? Or anybody name one of them? What's the first one?
The induction.
Induction phase.
Induction.
Yep, induction phase. Then what's the phase where the surgery is actually performed in? It's kind of like what you have done on your car to keep it running.
Maintenance phase.
Maintenance. So that's the maintenance phase where the anesthesiologist is just making sure you're stable and kept under deep enough so that the surgery can be performed. Then when they're ready to start bringing you out, what's that phase called? Come on, guys.
Emergence.
Emergence. And then once you're out and you're taken into the PACU, that's the last phase, and it is called
Recovery.
recovery. So in which one of these phases do you think the risk of aspiration is going to be the greatest?
The induction.
Induction phase. And in the induction phase, what is your role as a scrub?
To be quiet.
Very quiet. Basically not make a sound. So anesthesia will call this and you're just quiet. No time to be clinking instruments around or moving your Mayo stand, none of that. You're just going to be quiet. If there's anything that you can do that requires no noise, feel free to do that. But if it's going to make any kind of noise, you're not welcome to do that. Okay. There are a lot of drug questions on this exam. So if you have not been studying the drugs and those tables of the drugs, you definitely want to do that. So when we're talking about the patient is having like a craniotomy done, and we want to try to keep that intracranial pressure low, or if we need to reduce it, what medication do you think the doctor's going to have on that back table with you in the event that they need to drop some intracranial pressure?
Is that the mannitol?
Mannitol, yeah, that's the primary drug that's asked for. And then what if we're looking at malignant hyperthermia? What medication do you think they'll have on the table for that?
The naloxone.
Good guess.
The
Dantrolene. Dantrolene. Yeah, dantrolene is usually what's given for that. Naloxone is to reverse, like opiates. You know, if they're trying to bring you out quicker, they'll give naloxone. How are most medications absorbed? What's that mechanism? Where it's going from higher concentration to lower concentration. It's very passive, doesn't take any action for it to happen.
Passive
Okay.
transport.
Passive transport, thank you. And so a lot of these medications are absorbed in that way just because there's a higher concentration of it in the area that the injection was or the IV push was performed. So then it's going to be absorbed because there's more concentration of it in the bloodstream. So it's easily absorbed into the tissues because the concentration in the tissue is low. So it's just slides right over. Here's the wrong answer. I mean, here's the question that is wrong. I'm going to read this to you verbatim so that you understand which one this is. Because when you read it, actually, I'm not going to read it verbatim just because it may show up. Anyway, so if we're talking about a life-threatening cardiac event and it's in the ventricles, so remember that's really important. So when you're talking about heart anatomy, you've got 4 chambers. You've got the upper 2, the atria, and the lower 2, the ventricles. The ventricles are the life-supporting kind of, because you can have dysrhythmias in the atria and you still survive. Like atrial fibrillation, atrial flutter, you live through that. If you go into ventricle fibrillation, you're not going to live through that. Ventricle tachycardia, you're not going to live through that. So when the ventricles are in an arrhythmia, it is life-threatening. So when there is a life-threatening cardiac ventricular arrhythmia, there are medications that are given. And I'm going to tell you this, it's not on the test, but I'm going to tell you this, amiodarone is number 1. If you're doing anything where there is a risk of a patient going into cardiac ventricular arrhythmias, amiodarone will be in the OR. And so just know that anesthesiologist usually has all of those. But lidocaine is the choice on the test that it would be correct, but that's not the choice that they have. They have naloxone. That is not correct. So if you choose naloxone for the cardiac, life-threatening cardiac event, you will get it correct, but it is not correct. Does that make sense? Of the choices that they give, lidocaine is the best, and that is way down the list. It's not even the 5th choice, okay? So I'm not sure who wrote this exam where they got their cardiac information, but this is completely incorrect. But like I said, I'm not in Spokane to take this out of that loop. So choose naloxone when you're seeing cardiac ventricular a life-threatening event. So that's the only one that I saw in the test that really refers to that kind of a question. Make sense? Any questions on that? Pick naloxone, knowing that you're picking the wrong one. And just say in your head, they're so stupid. Okay. When anesthesia is intubating the patient and they're inserting the endotracheal tube, what do they put inside the endotracheal tube to give it that curve that will allow it to go through the through that airway passage and through the vocal cords? Do you remember what that is?
A stylet.
Say it again, Katie.
Stylet.
Stylet. So it's a little, and I think somebody else said it too, maybe Becky, but it's a little thin. It's almost like aluminum wire that goes through, but it's very bendable. And so they're able to insert that into the tube, and it helps the tube hold the shape, because otherwise the tube is just kind of floppy. And so you need it to be stiff enough that you can guide it through the vocal cords. So stylet. Now, when we're talking about patients that were concerned about hyperthermia or hypothermia, we have to think about the structure in the brain that regulates the temperature. So it monitors like heat and cold, and then it creates a feedback loop to adjust to that. What part of the brain is in control of our temperature regulation?
The hypothalamus.
Hypothalamus. We call that one the switchboard operator. Hypothalamus kind of like makes all those big decisions, and we don't think about it as being like a major part of the brain, but it is definitely like the switchboard operator. Already asked you that one. All right. We talked about some non-traditional types of anesthesia. What do you feel like when you were reading through that is the most non-traditional if we're talking about it being done in the US?
Acupuncture.
Yeah, acupuncture. I can't see any anesthesiologist saying, let's not give drugs, let's just do some needles here. But in other countries, that is definitely one of the things that's considered, is doing the acupuncture, allowing it to like change the signaling from the brain. All right. What are some signs that we will look for when we're suspecting malignant hyperthermia?
Hypotension,
Hypotension, what else?
decreased urine output,
And that comes along with hypertension, right? Because if we have low blood pressure, there's not a whole lot of volume, so it's not a whole lot to push that urine out. What else? What about cardiac?
Tachycardia.
Tachycardia. What's the output going to be in the cardiac?
is it slowed heart rate?
It's slower. So it's going to be, and it may not be, it's not going to be a slower heart rate. It's actually going to be the faster heart rate, but the volume is going to be less. So the reason that the heart rate is high is because the volume is less. So the heart's trying to compensate. So it doesn't have a lot of volume to push out. So it makes it run faster, trying to make up the difference. So that's what we see. And it's like a way to, it's trying to cool the body off. So it's trying to get as much blood out to the periphery to help evaporate. So that's one of the things that happens with malignant hyperthermia. So cardiac, urinary output are decreased. They have hypotension and tachycardia, right? Do you guys remember us talking about, or I say us talking about it, I was just talking to you in a lecture, when you're applying cricoid pressure. This technique was actually named after a British anesthesiologist. Do you remember reading about that and what his name was?
The Selleck's maneuver.
Selleck. So I always have to think of like Magnum PI, Tom Selleck, you know, that's the Magnum PI. Yeah, Selleck. And I'm saving all the drugs for last. So I'm kind of skipping over them, and then we're going to just hit drugs. So anesthesiologist, or the anesthesia provider, they have to do that an assessment where they do a physical status classification rating, right? So they're looking at patients and saying, are they an ASA 1, 2, 3, or 4? Correct? You guys remember that table? All right, so I'm going to give you some things that a anesthesia would be looking at, and you tell me what class they are. So they have had a myocardial infarction recently. So they're basically, it's called status post-myocardial infarction. So that means they've just had one. So they're after the heart attack. Their hypertension is very poorly controlled. They're massively obese. And they have severe systemic disease.
ASA 3.
They're an ASA 3. Exactly. So just be able to pick some of those out if you are given a patient scenario and you're needing to like grade them. Hemostatic agents. Which one is bovine derived? And what does that even mean? What is
Is that the
bovine?
thrombin?
It is thrombin. Do you guys know what bovine derived means?
From a cow.
From a cow. So thrombin is from a cow. What if it says it's porcine?
Pig.
Pig. And so you will see porcine valves, heart valves, and different things that are porcine, just because
I
some
have
of
a
their anatomy.
question.
Yeah,
Is all heparin made from beef lung, or is that just a certain kind of heparin?
it either is, all of it is, or it's synthesized from that. So as far as I know, they may have come out with something since I've been in a hospital setting where you know, in the hospital setting, you have your hands on it all the time. So you can read it. And I don't research it since I'm not in that setting and using it. Because we had to use it a lot with our art lines and stuff. I'm trying to get past all the drugs. Okay, when we're talking about drugs, and we have a list of safety measures, it's called the what? 6 what?
Rights of, oh God. Is it rights of administration?
Medication administration. Yeah. Can you guys name those?
Right route, right dose, right patient, right medication. Did I already say that one?
I don't think so.
Um,
Anybody else? Come in, help her out.
The right time and frequency.
Right time and frequency. One more.
Is it dose?
Right route of administration.
Route.
Like, how is it going to be given? IV, IM, PO, all of that. So there is a system of measurement where in the pharmaceutical world, they have based weight measurements on a grain of sand, is it?
apothecary.
The apothecary system, yeah, they based weight on a grain of something,
Wheat.
Of wheat.
of wheat. And then there is certain medications that are based on a grain of rice. I've seen that. What is that? Oh, never. That's the cannabis world. They base it on a grain of rice when they're dosing it. Okay. There's some kind of general pharmaceutical information. What are the 3 naming categories for naming pharmaceutical drugs?
Is it trade, generic, and chemical?
Trade, generic, and chemical. Yeah. And then if we're making a drug preparation and it is sweetened and it's also has alcohol in it, what is it?
Elixir.
An elixir, yeah. So if you're just thinking of sweetened but doesn't contain alcohol, that could be a syrup, right? But containing the alcohol, that puts it in the elixir form. Where does biotransformation of drugs happen? Most often.
Liver?
in the liver. Yeah, so this is why the liver takes a hit when there's a lot of prescription medications used or non-prescription medications. What's the medical term for normal breathing?
Eupnea or
Eupnea. What is it when it's fast breathing?
Tachypnea.
Yeah, it's actually tachypnea. You have to say it different with everything. Tachypnea. And then what if it's slow?
Bradyema.
Yeah, bradypnea. I've never heard it said that way, Tom. So good job. What vitamin does the body have to activate the clotting mechanism in the body? This is really important. There's a vitamin.
Vitamin K?
Vitamin K. Where do we find vitamin K? In our diet. You guys know? Leafy greens, like dark leafy greens, have a lot of vitamin K. So some patients that are on certain medications cannot eat a lot of dark leafy greens, which I think is crazy. But anyway. Okay. What are some, what is the source, if we're talking about like magnesium, calcium, zinc, what is that drug source?
mineral?
Mineral. And then what are some other types of drug sources other than mineral?
Synthetic?
There definitely could be some synthetic, so that's called biotechnology, right? Where they take the science and then technologically enhance. Where are some other drugs sourced from? We just talked about heparin,
Plant.
and there's plant. And then of course, like the heparin, that's from animal. What is the governmental regulatory agency that oversees pharmaceuticals?
The FDA.
The FDA. Now, as they classify these drugs, they're looking for drugs that cause birth defects. Do you know what those are called?
Is that the pterogens or?
Yeah, teratogen.
Teratogen.
Teratogen, yeah. And there's another question up here about this. Hold on. Okay. If you're looking at a teratogenic medication, and then we're looking at what category that fits into, so we've got some that are therapeutic, and then we have categories where things are addiction. Where would a teratogenic fit? It wouldn't be therapeutic.
Toxic?
Toxic, yeah. Because if it will cause birth defects, it's definitely toxic. It's so funny to see you guys like flying through your notes. Of course. I'm trying to keep it together a little bit more. I'm not to the drugs yet as a whole. I think I'm gonna have to go there though. I'm running out of. Oh, Yolanda, no worries. No, go, be safe. She's in Puerto Rico. Did you guys know that? What time is it there?
It is 9:30.
Oh, so it's the same as here, Eastern time.
Yeah, my flight leaves at 1 a.m., but I gotta make a little trip to the airport.
Yeah, get over there. No worries. It's recorded. You can catch it tomorrow night or tomorrow.
Thank you.
All right, safe flight.
Okay, thank you.
All right. Yeah, she texted me. She was like, I'm in Puerto Rico. I have to go. Get on a plane. All right. Okay, now let's talk drugs. All right. Why is ketamine contradicted on adults? Just so you know, while you're thinking of that answer, ketamine, it used to be used only with vets, and only recently has it been coming into the human aspect, within the last, I remember working for a pharmaceutical company in 2004, and we were starting to market it in topical agents, and we were getting a lot of fight back because it does have some dissociative qualities, and so it could cause some severe side effects in humans if not used correctly. So what's some of the side effects after using ketamine that causes it to be a contraindication in adults?
Hallucinations.
Hallucinations, yes, like morbid hallucinations to the point people commit crimes or suicide, things like that. So in the past, it was not recommended. And I think what's happened is they've figured out the dosing of it.
Well, they have a nose spray now too. I don't know if you knew that.
Oh, cool.
Yeah, one of my roommates had it one time because she had major surgeries.
Yeah. Yeah. It is great for pain. And I think what they've done is they've figured out how to dose it correctly now, because when it was dosed in the very, very beginning of being used, it was causing these morbid hallucinations. And that's the cool thing with medications. They're really learning how to use much lower doses and get the same effects or different effects in a lot of cases. So that's really helpful. All right. So thinking of vascular surgery and neurosurgery, what topical agent would be used to dilate the blood vessels during a procedure? Would you?
Heparin?
Heparin, yeah. Would you use epinephrine for that? What would epinephrine do? Yeah, Tony, I saw you say it. It would constrict. So you would use an epinephrine in situations where you want the blood vessels to constrict. Speaking of constrict, for the eyes, what kind of medication is going to be used to constrict the pupils?
Miotic.
Miotic, that's going to constrict that pupil. If we're talking about medications that will induce contractions and even reduce bleeding after a vaginal or a C-section delivery, what's that classification of drugs we're going to use for that?
Pitocin. I don't know.
Yeah, what's the general name for that? Do you know? Katie, you're spot on with the brand name. What's the other name for it?
Oxytocin.
Yeah, oxytocin, because that's like the normal hormone that does that, right? Our, I can't remember right off the top of my head, anterior or posterior pituitary releases that. I kind of think it's posterior pituitary that releases oxytocin. What reverses heparin? Darby, I wish you had a microphone. 'Cause I saw you say it.
Protamine sulfate.
Yeah. I think Darby's telling you the answers. I'm kidding. But she might be. Medications. You've got drugs on your back table and you're looking at the different containers. Which kind of medication container is going to cause the highest risk for you to injure yourself or contaminate the medication with glass particles? Darby, you need a mic.
Tincture.
What's that?
Tincture.
Tincture is the type of medicine that's in there. So what's the container that it may be in?
Need a vial.
Not a vial. Vials are usually going to be the plastic. We're talking about glass particles. Darby mouthed it. I'm going to say it. It's an
Ampule.
Yes, it's the ampule. So Darby, just start sign languaging. Some of us can read it, I'm thinking. Okay, we've already answered all of those. What is, hold on. What is the brand name for a microfibrillar collagen?
Adavine.
Yeah, Avitine.
Avitine.
Yeah, Avitine. And then let's talk about antibiotics. So we have, I'm going to name some brand names and you tell me what category it is. So, you know, there's a lot of different categories of antibiotics. So, and these are some very popular, so it should be easy for this to remember because you're going to hear this a lot. So there's Ancef, Kefzol, or Keflex. It's a really common category of antibiotics too.
So those are cephalosporins, right?
Yes, they are.
So what exactly is a cephalosporin? I was trying to read on it and I was kind of confused.
So cephalosporins just act on the bacteria in a different way. Cephalosporins normally are they're more specific for certain types of bacteria. And I kind of think that they are gram positive. Hold on, let me.
And it also said it's like first generation, which I was confused what first and second generation of that meant.
Yeah, I can't remember that either. Are cephalosporins gram negative or gram positive? She thinks negative and she knows microbiology way better than I do. And then first generation and second generation. Good question. I'm not sure. I can't remember that. It's been a while since I've studied farm. Okay, I'll get you that while this is loading and send that to you in the email. Good question, because there is definitely a difference. I almost had it. I can't remember. It'll come to me and I'll include it. All right. So we've heard a lot about fentanyl, right? And that's a big problem in drug addictions. So that's the generic name. Do you know what the common name is for it? If you guys could read Darby's lips, she's just like, yep, there you go, Sublimase. I think it should be called by its Sublimase name. It would probably be more popular. If we're looking at a ratio of a solution, the solute to solvent, what is that called? Because that's what we're needing to really know.
Solution?
What's that, Katie?
Solution?
Yeah, so the solution, we've got solute to solvent. What is that ratio when we're talking about like documenting things, or what does that ratio represent of the solutions? Solute to
Concentrate?
solvent. Yeah, it's the concentration. So however much solute is in that solvent is telling us what the concentration is. Because it doesn't really matter what the solvent is. That's just a way to hold the concentration of the solute, right? Because normal saline is not necessarily medication, but when you add a powdered solute to it, that's the concentration that's important. It's not the normal saline concentration that's important. It's how much solute is in there.
So in that example, is the powdered medication, wouldn't that be the solvent? Or am I getting that confused?
You're getting it confused.
Okay.
And so here's the way I always remember it. And if you guys ever took chemistry, you'll remember this. When you are like stirring a vial with something in it, you wait until the solutes settle at the bottom. That's your powder. The solvent is what it's going in. Okay. If a drug is being given sublingual, how is that going to be given?
Place under the tongue?
Placed under the tongue. Yeah. That is sublingual. And then if a drug is either enhancing or potentiating the effect of another one, what is that type of reaction called? Just sign it, Darby. She's mouthing them. It's hilarious. Nobody? So it's enhancing another drug. And the opposite of it,
Agonist.
Additive?
it's an agonist, yes. And the opposite of that is an antagonist, right? So it is like interfering with its action, correct? If we're doing a cardiovascular surgery and we really want to prevent clotting when we're putting in like a graft or something, what kind of irrigation solution are we going to use while we're placing that graft? What medication are we going to soak the graft in before we place it in that area? I saw her say it, heparinized saline. Darby, you better get a microphone. All right, let's talk about eye surgery. So we're needing to provide local anesthesia around the optic nerve. So what kind of block are we going to use? Anybody?
The retro bulbar.
Yeah, retrobulbar. Yeah, absolutely. Now, talking about nerve conduction blocking agents again, what class are lidocaine, bupivacaine, and ropivacaine in? Yep, amino amides. I saw her say it. I'm gonna quit looking at you, Darby. I'm gonna move it so I can't see you because nobody else is guessing. And it's not guessing. You got to know this stuff. It's on the test. Okay. If we're doing a procedure on places like fingers, toes, penis, or in neonates, what medication are we going to be really careful if we're using local anesthesia? What are we not wanting to use?
Epinephrine.
Epinephrine.
We don't want to use epinephrine in those areas. Yeah. And then what kind of topical agents giving you a freezing method?
Ethyl chloride.
Yeah, ethyl chloride. And then if we're talking about spinal anesthesia, what is a term for that? What do we also call spinal anesthesia?
Epidural.
Epidural is one, and that is going into the cerebral spinal space. When we are just talking about what do they call it in the book? I can't remember what that was called when it was the intrathecal, it's going in between the meninges basically. So it's going between the, I don't think you have to know this, but I kind of think it goes between the dura and subarachnoid and the arachnoid. Okay. What is it called when we use an S-mark bandage and a double cuff tourniquet in the beer block anesthesia technique? What is that done when we're doing that to the upper extremity?
Exsanguination.
Exsanguination. Yeah. All right, let's talk about hypothermia a minute. So when we induce hypothermia and we drop the patient's temperature down to 68 degrees or below, what level of hypothermia is that considered to be?
Profound.
Profound. They are deeply under. Yeah. What kind of neuromuscular blockades can cause the muscle fasciculation? And we cannot reverse that. So these are certain types of agents that when we're using them in a nerve block, these are depolarizing agents that if they're used, it starts that depolarization process and medication cannot reverse it. So it has to go through the depolarization and then it reverses itself through repolarization. So we can't really inject a medication to start repolarization. It's going to repolarize by itself just with that influx of sodium potassium. So that's what repolarizes the muscle. We can't push a medication to repolarize it. What IV solution is similar to plasma? Because it has water and it also has some electrolytes in it.
Is that like Ringer's solution?
Yeah, Ringer's is another one. There's another one. I lost it. So there's lactated Ringer's and then just Ringer's, I think. But for sure, Ringer's. Is this helpful? Yeah, okay. What is a class 4 or category of class 4 that has let's see how I can. So these are drugs that have like sedative, tranquilizer kind of effects. Anesthesia does use these, and they provide like amnesia, and they also provide muscle relaxant effects. What are some of those drugs? Benzos, as you'll hear them called. So these are benzodiazepines. So anesthesia is going to use these along with their other medications because it does help produce that amnesia-like effect. So then we're able to we don't have to worry about the patient remembering the procedure, even if their level of consciousness came up a little bit. What would, when we talked about agonist, antagonist, what would you consider Narcan to be? Naloxone.
An antagonist
Antagonist to what?
to like drugs,
Which ones?
like
You're getting there.
opiates. Oh man.
To what?
I know that's what they give to like reverse people that have overdosed.
Yeah, so it's a narcotic antagonist.
Okay.
Yeah. See, you talk through it. So what kind of agents are used that anesthesia delivers through an anesthesia circuit, and then it passes through the bloodstream through the respiratory system? What type of agents are those? Think about it. It's more simple than you're making it. We're using a circuit and we're putting it, either the patient is intubated, so it's going through their system, through their respiratory system, and then it gets into the blood. So what type of agent is that going to be considered? Because remember, the agents are called for their delivery, Rachel.
Inhalation.
Yeah, so it's an inhalation agent because it's an agent that is delivered through inhalation. So which part of the blood contains the clotting factors?
Platelets.
Platelets, yes, they do. So what in the OR setting, those are going to be removed from one unit of whole blood, and then they're given in this format in the OR. Do you know what that's called? I'll give
Is
you.
this the auto transfusion?
No, this is actually fresh frozen plasma. So they take a whole unit of blood, and then they remove the all the components that contain the blood clotting factors, and then they give that back. What are the markings on the syringes that allow you to precisely measure things for the procedure? Do you know what those are called? They're called calibrations. And the way that you can think of this is they're correct every time. So like think of a machine, you know, like you may be running a machine, and I use this in the lab, or even like scales that you use at home or whatever. How do you always know that they're actually accurate? Well, they have to be calibrated to know that they're accurate. Well, laboratory measuring devices or syringes, they're always calibrated. And so those measurements are called calibrations. Didn't know that, did you? Well, now you do. All right. So what does it mean when they say this is an indication for this medication? What does an indication really mean? Think it through. When I say, this is the indication, tell me, what are the indications for Tylenol? Or what are the indications for ibuprofen? What's some things that you use it for?
Like to treat a condition?
Yeah,
So
it's
like
the medical,
pain or swelling or something?
yeah, it's the medical conditions that are common to a particular medication. So those are what it's indicated for. Okay. When we talk about a drug actions, what all does that include? There's several things that is involved.
Is it like the side effects and the? That's the only one I can think of. Side
Yeah,
effect.
So yeah, that is like one of the last parts of the action. So that would be more of a separate category. So thinking about drug actions, you're having to think about what is the drug doing? You know, like what is the target site of the drug? What is the theories around the receptors that are that it is addressing, or the enzymes, or even interactions or non-specific interactions. So all of those are collectively what makes up a drug action. So and then what all is involved in pharmacokinetics? I'm gonna let you guys work through this one.
That's how the drug is absorbed in the body, right?
Yeah, that's the first part of it, exactly. So it's how the drug is absorbed. There's four main parts of pharmacokinetics. How's it absorbed? And then once it's absorbed, what's the next step?
Like where's it going? Like distributing?
Distribution. Yeah. And then the next step happens in the liver. And what is that step? Biotransformation.
Oh.
Yeah. And then what's the step that happens in the kidneys next?
Excretion.
Excretion. So you got, these are what happens in the pharmacokinetic: absorption, distribution, biotransformation, and excretion. So you have to think of that as a process. Don't think of it as something I have to memorize. Think of it, I take a medication, okay? I'm taking this drug. My gut is really messed up. I can't even absorb my food. So my absorption rate is going to determine how effective that drug is for me. Because if I can't even really absorb my food, am I really going to absorb this drug, or is it not really going to work for me? And then once it's absorbed, if it does, then it's about being distributed to the target site. And then once it's delivered, then it's going to the liver to be biotransformed. And then it's going to move to the kidneys to be excreted. So try not to think of these as just, I have to memorize them. Try to think of it as the process of how something is occurring. And that will make you know it rather than just memorize it. All right. I'm looking at the true or false to see if I even need to go over this, because we went up, some of it's repetitive. So if a patient takes a medication for a long time, could they build up a tolerance and have to increase the dose?
Yeah.
Yeah. How do you convert pounds to kilograms? What's the easiest way to do it?
You divide by 2.2.
That,
Divide the weight by 2.2.
that is true. There's a really easy way to do it though. You take the pounds, divide it in half. Then you subtract the first digit from the answer. So like, let's say the person weighs 100 pounds. Divide that by 2 and you get 50. Then you take that first number away from that. So 50 minus 5 is 45. So they're 45 kilograms. That's the easiest way to do it when you're standing at that back table and you got to calculate this quick. You'll get really, really close. Because you're sterile, you can't whip your phone out and use your calculator. So it just in your head, you're like, okay, they're 160 pounds. You say, okay, that's okay. So you're doing it that way. And it is a quicker way to do it. And also remember, you have a pen on your back table. So there's nothing wrong with jotting that down somewhere or asking Circulator to convert it, you know. So, but if you're in a situation where you're having to calculate, divide it by 2 and subtract the first number. That's the quickest and easiest way to do it. Okay. All right, that is all of them. There were a couple I didn't read you, but they were super simple. All right, any questions on this? I'll get you that first and second generation cephalosporin because I cannot remember. Questions? You guys feel good about this?
Can you clarify what isobaric solution is?
Say that again.
An isobaric solution?
Isobaric?
Did I say that right?
I don't know.
I was trying to find more information about it in the chapter and I couldn't find it, but it might not even be in there.
I'll look and see. I mean, I know about isotonic. It wasn't that. Okay, I'll look and see. I don't know. I have to say, these scrubs that wrote this book, sometimes they put stuff in there and I'm like, I've never even heard of that. Why are you making them learn this? And it may be a different world in there. I don't know. Were you guys super sad about class being canceled last night? Yeah, you guys cried all the way home, didn't you? I'm sure. So I get this weird text from Nuwana and she's like, where's the instructor tonight? And I'm like, I don't know. Is nobody there? So then it was like, Sam apologized profusely today. She totally got mixed up. She was already home before they reached her. So, but it was because we had juggled some and she got mixed up. She felt so bad. I wish I had only forgot one time. That would be great. So, you know, it's just the way it is. Okay, that is all that I have for tonight. Now, I will not have this recorded until Friday morning, the next one. Just because I had to teach a class today for a school in Austin that it took me all day yesterday to prepare for and all day today to teach it. So I haven't got it done yet. So I will get that done Friday morning and it will be uploaded as soon as it lets me upload it. Sometimes it just takes forever to load into YouTube because of the timing, I guess. So I'll send out a group text as soon as it's uploaded so that you know that it's there. Or usually what I like to do is send it when it's uploading so that it's at least going into YouTube at that point. And then when you're where you can check it. Sound good? All right, remember the wrong answer. What's the wrong answer you're going to put down tomorrow night for a life-threatening cardiac ventricular event?
Naloxone.
Naloxone. Wrong answer, put it anyway. Okay, I would tell you what C it is or whatever, but it'll shuffle, so I'm not sure that that'll be the correct thing, but it's naloxone is what the key has it as. If it comes back and tells you that's wrong, let me know. None of the answers are right, I'll tell you that. So it don't matter what you put in my book, you're getting it right, even if we have to go in and correct it afterwards, because they're all incorrect. It should be amiodarone. Okay. Any questions, comments?
Yeah, are we gonna be able to get like the answers for the homework? Or
Oh,
how are
gosh.
we turning our grade in? Because we didn't get it last week either.
Sorry. Let me make myself a note. Yeah. So you need 8 and 9.
Yes, ma'am.
Got it. You don't have to call me ma'am. I'm old, but I'm not. Well, okay. It's okay now.
It's a habit, I'm sorry.
I know, I get it. It's that for me too. All right. Okay. I appreciate all of you doing good work. You're becoming a scrub. You guys seen that show yet? Scrub. It's corny as hell. Spring made me watch it. I hate corny comedy shows, but it was actually pretty cool. But it's not about scrub techs, so don't think that is the case. About young, kind of stupid doctors. Okay, that's all I got. You guys go study, and I'll load this on the channel as soon as it converts. It may take a little bit, but I'll get it up. All right, see you guys
Thank
next
you.
week. Thank you.
Thank you.
Thank you.
Have a good night.
Good night, everybody.